Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. And if you still need them granted, please leave us another message in the chat. And Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, typically I begin by talking about the infectious disease situation here in Ohio, and I'm very pleased to say that we have little to report on that front. Levels of COVID, influenza, and RSV remain very low in Ohio. We have reported one more case of measles in Ohio. It was in May in Montgomery County. This was a case associated with international travel and marked the sixth measles case in Ohio this year. That's a great reminder for us that measles is a vaccine preventable disease. Please make sure that you're up to date on all of your vaccines because this latest case of measles was, in fact, picked up overseas. So it's especially important that your vaccines be updated before you travel abroad. It's also a good time to start thinking ahead to the fall about where you might get your annual flu shot or perhaps your updated COVID shot if you've not had one yet. If you're going to be between 32 and 36 weeks pregnant this fall, as RSV season begins, the CDC also recommends that you get a vaccine called Abrysvo. This vaccine will help protect your new baby from RSV, which can be, I think, as people know, a very serious illness in infants. Well, based on the recent weather we've had, it's obviously the heart of summer in Ohio. And as a state that produces an abundance and variety of agricultural products, summer provides us an opportunity to visit our local farmers market where we can support local farmers and get fresh, healthy food. I talk a lot about the importance of healthy eating as an essential step toward addressing our risks of obesity and chronic illnesses such as diabetes, high blood pressure, and cancer. Conditions that can affect our quality of life or even shorten our lives. But as important as healthy eating is, we're well aware that not everyone may have access to fresh produce on a regular basis. Barriers such as income, a lack of full-service grocery stores in your neighborhood, or a lack of reliable transportation can limit an individual's or a family's food choices. The Ohio Department of Health operates the state's special supplemental nutrition program for women, infants, and children, which is commonly known as WIC. This is a vital program that produces crucial nutrition for our most vulnerable Ohioans. Since 1992, Ohio WIC has included an added benefit called the Farmers Market Nutrition Program, which provides coupons to our WIC participants specifically to be used for fresh fruits, vegetables, and herbs at their local farmers market. This program has been around for a while, but we've worked hard to scale it up in recent years. Just over the past decade, we've grown from having WIC participating markets in 57 counties in 2014 to now this year, 70 counties. I've spoken about our Creating Healthy Communities program before. It's a program dedicated to helping communities increase access to healthy food and to creating more opportunities for active living. Our CHC program coordinators have worked with WIC to bring more farmers markets into areas of the state which suffer from high levels of food insecurity or into communities that have expressed a desire for access to more healthy produce. Now, as I mentioned, the WIC Farmers Market Program is an add-on to the regular WIC benefits. Like the regular WIC program, the Farmers Market Program is completely federally funded. through money that ODH receives from the U.S. Department of Agriculture. How it works is that WIC participants can receive one booklet of 6 $5 coupons to use for fruits, vegetables, and herbs at a farmer's market. The coupons can be used from June 1st through October 31st. Across the state, local WIC agencies recruit farmers to participate in the program. After farmers receive WIC coupons from customers, they then redeem those with the Ohio WIC program and are paid. I'm pleased to report that Ohio has a redemption rate of 64%, which is much higher than the average rate of 38% among the other 6 states in the Midwest region of the USDA's Food and Nutrition Services program. Last year, ODH's Ohio WIC program paid $575,920 to farmers who participated in the farmers market program. That's an incredible win-win for Ohio. First, we of course are getting more fresh produce into the hands of Ohioans who need it. Secondly, we're supporting Ohio farmers, many of whom are running relatively small and perhaps family-owned businesses. This is a way to boost the local economy and also honors Ohio's rich agricultural heritage. I'd encourage all of you to read the news release about this program that we'll be sending out shortly after this press conference. It contains photos as well as audio and video clips that you can use with your stories, including an interview with a co-owner of a small Lincoln County farm who's enthusiastic about participating in the WIC Farmers Market Nutrition Program. Later this year, we're piloting a new program called Double Box. This is a limited opportunity for families to use a second book of WIC Farmers Market coupons, another 6 $5 coupons, and this will only be available on August 5th in Franklin County at the Prairie Township Farmers Market. This pilot is being funded by the state at a cost of $15,000. And ODH is not the only agency involved with helping people get more access to healthy foods at our farmers markets. The Ohio Department of Aging has a senior farmers market nutrition program where Ohioans who qualify based on income can receive $50 annually to be redeemed at markets. This program has expanded this year to all 88 counties and also has been modernized to provide an option to use an app-based system. Additionally, the Ohio Department of Job and Family Services has contracted with 100 farm markets in nearly 40 counties to accept their Supplemental Nutrition Assistance Program cards, or SNAP benefits. Like the ODH WIC program, the Department of Aging's Farmer Market Program and the SNAP Benefits Program are all federally funded. The CDC reports that only 4 in 10 children and 1 in 7 adults nationally eat the recommended daily allowance of fruit, and the numbers are even worse for vegetables. The CDC says that 1 in 10 Americans eat the recommended daily amount. Programs like the WIC Farmers Market Nutrition Program and other programs I just discussed are an important way to try to improve those statistics and hopefully help more Ohioans improve their health and lead healthier lives. And now, to further discuss this topic, I'd like to welcome in our first guest today, Dr. Courtney Bott, an adolescent medicine and obesity expert with University Hospital's Rainbow Babies and Children's in Cleveland. So, Dr. Bott, how important are fresh fruits and vegetables in a young child's diet? And what are some of the practical ways that parents can help create a healthy diet for their children?
Yeah, thank you. So fruits and vegetables are vitally important. In fact, our current nutrition recommendations using the MyPlate model suggest really that fruits and vegetables should be about half of a plate in a well-balanced meal. These things, fruits and vegetables, contain necessary vitamins and other important nutrients. One example of those is fiber, which has many benefits, including things like helping with digestion, helping people to feel full, to prevent overeating. And in order really for kids to get the most benefit, they should be eating whole fruits and vegetables as opposed to fruit juice, although some fruit juice is okay, depending on the child's age. In terms of some strategies that parents can use, I think one of the best strategies actually is for parents to model these behaviors for their kids. So again, using that MyPlate model, where half of the plate is fruits and vegetables, about a quarter of the protein, about a quarter is whole grains with some dairy products like milk. Continuing to expose kids to new fruits and vegetables is also important, without forcing them to eat the complete plate of those foods. And that helps kids eventually get used to new foods and eating a variety of foods. We really encourage what we call eating the rainbow. So all colors of fruits and vegetables to help get all of those necessary vitamins and nutrients. For families who have difficulty accessing foods, we actually also have additional options here at UH and Rainbow that might be helpful. We have a program called Food for Life, which is a medically tailored grocery program in which dietitians actually work with our families and can help with access to healthy foods through our food pantries. So lots of options out there.
Very good. Thank you, Dr. But it's summer, which means ball games, fairs, and ice cream stands, which are all fun things for kids during the summer. But how can parents keep a good balance between some of those fun summer foods and their overall diet this season?
Yeah, absolutely. I like good ice cream, particularly in this heat we've had, as much as the next. And I think it's absolutely part of a fun summer. And eating those foods in moderation is great and expected. Some recommendations that we could use for parents would be things like trying to pack some nutritious snacks. So pack some apple slices or cheese sticks or whatever might be appropriate in this setting to eat along with some of those other treat type foods like ice cream. Other things in addition to, trying to spread out some of those events maybe that you're going to, but setting expectations for children about what they might expect and what would be acceptable at each of those events. And then finally, continuing to practice good nutrition habits as much as possible in this setting that we're in. So whether you're at home or outside the home, again, trying to stick as much as possible to that the MyPlate model with some of those more, fun foods, ice cream in moderation.
Thank you again, Dr. Bott.
Thank you for having me.
Yes, thank you. And our next guest joins us now to help us better understand what a farmer's market and the WIC Farmers Market Nutrition Program can really do for a community. Oscar Hernandez is the Williams County Health Commissioner. Commissioner Hernandez, can you tell us a little bit about the health landscape in Williams County, where you're commissioner, in terms of perhaps the level of food insecurity or the needs that you're seeing in terms of access to healthy foods such as fresh produce?
Thousand individuals. We are a rural farming community, and we have 7 municipalities, with Bryan, Ohio being the community seat. A majority of our farmers participate in farm stands and farmers markets. However, a majority of them farm soy, wheat, corn, and other smaller commodities. Currently in Williams County, we have 3 approved WIC vendors, and those vendors include Walmart and Chief Supermarkets, along with Miller's Market, a smaller local vendor. We have some opportunity there, where Walmart and Chief Supermarkets is currently located in the northern center of Williams County, Only Miller's Market is located in the northern center part of the community, and that provides an opportunity for those individuals living in the other parts of our county. Williams County does have a plethora of Dollar Generals, Family Dollars, and Dollar Trees. However, most of those do not meet our WIC vendor guidelines here in Williams County. For us, looking at our data, we currently have 3 areas of opportunity in our county, with 13 to 21% of those community members experiencing poverty. Now, the same CDC data shows us that 40% of that same population, 18 years or older, is experiencing obesity. Now, if you look at our 2022 community health assessment, 6% of our Williams County youth surveyed reported that they had opportunities, access to food to eat, clean clothes to wear, or someone to protect them. Now, we know that those contribute to adverse childhood experiences, which impact their potential emotional, cognitive, social, and biological development. And also that same 2022 health assessment tells us that obesity has been on the rise for those surveyed, going from 14% in 2019 to 21% in 2022.
Well, Commissioner Hernandez, so, thinking about those community challenges, how has the WIC Farmers Market Nutrition Program helped your community? What level of participation are you seeing, for example, among farmers? And what impact do you think it's having on the local economy, as well as on your residents?
Yeah, absolutely. So our current caseload right now is 689 participants. So we're approximately 50 over our caseload. If you look at our caseload in the past 5 years, in 2017, going back that far, we had 767 participants. In 2021, exiting COVID, we had 594. So we've been in a variety of different opportunities in who wants to participate with our program. Now, if you look at how our farmers have participated, we've definitely seen an increase in that. For us, we have had 40% participation in 2021, but that has grown nearly 30% in 2023. So last year, we had 480 coupons for a total sum of $2,400, and we had redeemed 333 of those. So that's an influx of 1,665 to our local vendors, and that's great. For us, we are looking at our amazing partners here in Northwest Ohio. So if you look at Putnam County, they had 100% redemption. Hancock County had 83%, Defiance County at 72%. And we look to model some of their great practices, but we attribute a lot of our successes here to our WIC team and being able to share those resources to our individuals. So Colleen, our WIC director, and Roberta and Jamie and Becky and Megan, those individuals who are our WIC team here, they help drive this program and help create a clientele that really wants this product. If you look at the participation, those WIC families, they're working families, and it helps build those relationships locally and helps keep those dollars here in Williams County. Now, we know that a lot of successful businesses, big or small, are built on relationships and basically positive word of mouth. Now, this word of mouth carries in a variety of ways, intangible ways. So if you look at buying a nice succulent watermelon or juicy peaches, and you have that word of mouth going from one family to another that I purchased this here in Williams County, that helps grow that. And we are seeing that in our participants in our farmers markets. Now, this is also great for us because this is a great resource, but it's also helping us with our community health improvement plan and making one of our goals, which is the primary goal, is to make the healthy choice the easy choice. And it starts with these small wins. And we believe that, again, this program is just one step in the overarching goal to bolster and create both a positive economic and physical healthy community here in Williams County.
Thank you very much, Commissioner Hernandez. Well, as I conclude today, I'd like to talk about some basic safety precautions that are so important to good health this time of year. First, of course, is to protect yourself against the extreme heat that we've experienced already this summer. ODH put out a news release a few weeks ago listing a number of precautions, so I encourage you to look at that for some tips. Tops among those heat-related tips are to drink plenty of fluids, limit your outdoor activities during periods of extreme heat, And please also be mindful of your elderly friends, neighbors, and family. Maybe check on an older neighbor, as they are generally more vulnerable to heat-related illness. This is also fair season in Ohio, so in addition to the heat, we need to be mindful of using sun protection, including sunscreen with an SPF of at least 30 when we're planning out-of-door activities, and to make sure that we all wash our hands or use hand sanitizer after touching any farm animals, because we can pick up germs from animals just like we can from other people. Picnics and cookouts are also great summer traditions, and we enjoy these summer gatherings. But as we do so, we need to ensure that we're protecting ourselves against foodborne illnesses by keeping cold foods cold, that's 41 degrees or lower, and hot foods hot, that's 135 degrees or higher. Foods kept in between those temperatures are in a danger zone in which harmful bacteria can grow quickly. And finally, swimming and boating are yet another great way to enjoy Ohio's many outdoor recreation areas and help us cool off during Ohio's summers. But there are also some important precautions to take on the beach or in the water. First, when swimming, please don't swim alone. Keep a close eye on your children and swim only in designated areas when at a beach or lake. When boating, always wear a life jacket and make sure everyone on board does the same. Check on weather and water conditions before going out on the water, and make sure you're familiar with the state's boating laws and rules by reviewing the Ohio Boat Operator's Guide. Summer is a wonderful time to enjoy the great outdoors in Ohio with friends and family. Keeping these basic health and safety tips in mind, I hope, will allow all of us to enjoy the fresh air and fresh foods that Ohio has to offer this summer. Thank you. And with that, Ken, I think we're ready to take any questions that there may be.
Well, thank you, Dr. Vanderhoff. We have no questions lined up today. So unless someone has a last minute question, I would toss it back to you for closing remarks.
Well, very good. Thank you all again for your attention to this press conference. And I appreciate all the efforts that have already been undertaken around the state to share some of these important summer health messages, and look forward to the continuation of a happy and healthy summer here in Ohio.